This segment of Delmarva Life is sponsored by TidalHealth.
Well, you've probably heard the phrase, the best offense is a good defense. This isn't just an effective sports strategy laid out with X's and O's. The idea behind this mindset can have much broader application in life.
Yeah, in the world of health, this can mean preventing potentially harmful conditions and diseases before they take hold, even keeping symptoms at bay with a few calculated and smart decisions. It is Cardiac Rehabilitation Week, and we're happy to be here with Chris Evans. He's the Director of Cardiovascular Pulmonary Rehabilitation and Preventative Cardiology with Tidal. Did I get all those syllables right?
I think you got it.
Oh my
Perfect.
goodness. TidalHealth covers everything on this. Thanks for joining us. It's good to
Thanks
have
for having me.
So I'm going to ask you the very basic question. Why is it so important to focus on prevention and recovery in the cardiac area?
So, like you mentioned, this is Cardiac Rehab Week.
Right.
February is also American Heart Month, so we
Right.
kind of got double celebrations or double awareness going on here. With Cardiac Rehab Week and with Cardiac Rehab, kind of our main goal is preventing future events. Unfortunately, when they come to us, they've had some sort of event,
Right.
Whether it be heart attack, open heart surgery, heart valve repair, congestive heart failure. They've come to us with some sort of disease. So our job is to make them feel comfortable, let them know kind of what happened, what caused this, how to avoid it, and to kind of build that lifelong lifestyle modification that they can continue carrying on and prevent future events.
Right. Can you give us an overview of TidalHealth's comprehensive cardiac program?
Sure. So our cardiac and pulmonary rehab, we have one here in Salisbury. Nanacoke also has one as well with their under TidalHealth. But our one here in Peninsula Regional, it's been, we started in 1986. It's been nationally certified since 2000. We have a couple different programs within it. Cardiovascular rehab, obviously we're focusing more on the heart and heart disease. Pulmonary rehab, and then we also have some other programs, peripheral artery disease rehab. Our phase 2 program is for people that have had those recent events. We get to work with them for 36 weeks and again, kind of set the groundwork for them. And then we also have our adult fitness program, which is more as our maintenance or for people that have not had an event but just want to live a healthier lifestyle and kind of be supervised.
What would you consider a typical cardiac rehab program?
We're looking at kind of the whole body. Obviously, when you think of cardiac rehab, you think of exercise.
Yeah.
So, exercise is obviously very important. We're trying to strengthen your heart, just like your heart's a muscle, just like the rest of the body. We need to strengthen those muscles and make them become more efficient. Your heart delivers blood and oxygen to the different parts of your body, and when we make it more efficient, it's able to do that with a little bit less stress. So those are kind of the things that we're focusing on for our program.
Yeah.
So do education and lifestyle factors, are they factored into this as well?
Absolutely. So we kind of look at the whole body when we're looking at it, not just the physical, the mental, and then looking at those lifestyle modifications as well. We also have with our program, we have a structured exercise training routine that we go with, again, to help that heart be a little bit stronger, be more efficient. We also do education. We want them to know the disease, what it's about, what it does. When you're a little bit more familiar, it's a little bit easier or a little bit better to digest how to treat that. So we're looking at different risk factor modifications, high blood pressure, high cholesterol, diabetes, stress, obesity. We're looking at all those things and how we can prevent those or keep them under control. With that education, how to use diet, exercise, and those lifestyle modifications to kind of just let them know what they need to do. Right. And then our goal is, again, we have them for 36 weeks, or 36 sessions, excuse me, and we want them to kind of build the groundwork, know what to do, and then continue on with that lifestyle modification into the rest of their life.
It's important stuff here.
Absolutely.
Okay, so how do we get involved in the cardiac rehab program? Do we need to be referred by our primary?
Yep, so unfortunately, in order to come to our phase 2, you have to have some sort of event. Okay. So, we don't obviously wish that on anybody.
That, right? Okay.
But we do get a referral from a cardiologist or an MD, and then we will reach out to you and get them enrolled in the program. But if our adult fitness program, again, that's for anybody that just wants to be supervised with our nurses and exercise physiologists, whether you've had an event or you just want to stay healthy. they can reach us at our office, 410-543-7026, and we'll get them all signed up, ready to go.
And we'll, of course, have that number and other information, other links for you on delmarvalife.com. Click under What's Happening Today. Chris Evans with TidalHealth, thank you so much for coming in.
Thanks for having me.
Wonderful talking to you.